Now, it was meant to be the day England unlocked after months of restrictions, but now the Health Secretary Matt Hancock has confirmed that ministers are considering leaving coronavirus restrictions in place beyond June the 21st, amid concern over the spread of the Delta variant, which was first identified in India. He revealed that scientific advisors have told the government that the Delta variant is 40% more transmissible than the Alpha variant first detected in Kent. Here's Paraic O'Brien.
The Delta variant, first identified in India, the UK's latest epidemiological curveball. Responsible for a large spike in COVID cases, but so far doesn't mean more hospitalisations. Thanks in part to the effectiveness of the vaccination programme. The Health Secretary today, though, said it was much more transmissible than previous variants.
Well, the best estimate of the growth advantage, as we call it, of the Delta variant from SAGE is around 40%. So
40%.
That does make life more challenging for everybody. And you've seen that the case rates have risen a little. But the good news is that the hospitalisations, the number of people arriving at hospital, is broadly flat.
The Delta or Indian variant is scrawling a big question mark over the possibility of restrictions easing come the 21st of June. Matt Hancock went on to say that the government is open to delaying what's become known as Freedom Day. There are reports today that the new date could be pushed forward by a fortnight to the 5th of July. In terms of navigating a way out, and off the back of a report by his Institute for Global Change, Tony Blair spoke today about the need for a way of proving vaccination status to enable travel and free up the economy, something the Health Secretary did not discount.
I think since everybody's going to be able to get the vaccination, other than those, as I say, who for medical reasons can't, then I think it really is important that people get encouraged to get vaccinated. And we also make suggestions as to how we can make sure you get proper proof of vaccination. I mean, actually, the NHS ex-people have done a good job in the NHS app, but we need to make that interoperable with other systems so that you can use this as proof of vaccination throughout the world.
Finally, to the global picture. At the G7 summit next week, the Prime Minister will be urging wealthy countries to commit to vaccinating the world against COVID by the end of 2022. The exact quantity of doses or cash equivalent that the UK will contribute has not yet been announced. The Health Secretary highlighted the fact that the UK contribution is already substantial in other ways.
A quarter of the vaccines delivered so far around the whole world are ones that have been delivered with UK taxpayers' cash, Oxford University, AstraZeneca, at cost, no charge for the intellectual property. And that is saving lives right now everywhere.
Vaccination is being opened up to under 30s in England next week, and the Health Secretary said today that the government was taking clinical advice about whether children should be vaccinated after the regulator approved one of the vaccines for children between 12 and 15. In terms of the country coming out of this, there have been more crossroads than in a grid street plan. But this month will probably go down as one of the most significant junctions.
Well, I'm joined now by Dr. Deepti Gurdasani, an epidemiologist and senior lecturer at Queen Mary University. Welcome back to the programme. Dr. Gurdasani, you and others have been warning about the Delta variant being more transmissible. What do you think needs to change in terms of restrictions now?
So I think the focus on June 21st sort of detracts from the fact of where we are now, because we are in a crisis now, and SAGE modeling has shown that with a variant that's more transmissible and has some ability to escape vaccines, we could still exceed the level of hospitalizations compared to Jan if we don't act now. And those are just talking about stage 3 reopening from May 17th. What we need to do urgently is reintroduce mitigatory measures in schools. We hear even from Matt Hancock that a lot of the infections right now are happening in schools. We can see this in our data with secondary school-age children having the highest rate of infections. We need urgent attention to masks and ventilation. We also need a long-term strategy of how to tackle this, and that means fixing our test, trace, isolate system and reintroducing those controls at borders and having managed quarantine with all countries so that we don't end up in a situation where we import yet another variant that's potentially more transmissible, more severe and able to escape.
Yeah. You mentioned children there. The MHRA, the UK regulator, has said the vaccine is safe for 12 to 15-year-olds. What's your opinion on now rolling out a vaccination programme for children in the UK?
I think is vitally important. It's very clear that children not only transmit substantially, but also that they also get affected by things like long COVID. So it's important we roll this out. And it looks like the government is planning to roll this out in autumn. Unfortunately, that's not going to be fast enough to deal with our current peak, which is due in July. So it's very important that alongside vaccination in children, which is really, really important, we also focus on mitigations in schools, because unless we do that, we're going to see case rates rising in children with all its impacts on children, educational disruption, and on their families and the communities.
Yeah. Is it morally right, though, that we should be vaccinating children who are still at relatively low risk in the UK when vulnerable people in less wealthy countries are struggling? I'm thinking of places like Nepal pleading for help. Only 2% of their population has been vaccinated.
So this is a false dichotomy that's been created, I think, on ideological grounds. The UK has 4 times the number of doses it needs to vaccinate its population. Out of those 400 million doses that it has, using about 8 million to vaccinate a dollar cents is not going to make a difference to vaccine sharing. If the UK is really serious about vaccine sharing, it should start doing it now. It should support vaccine patent waivers, which it hasn't done, and increase foreign aid funding rather than cutting it. So I don't see this as a dichotomy at all. Why can't we vaccinate our children, protect them, as well as donate vaccines? It's very important we do both of those things.
OK, Dr. Gurdasani, have to leave it there. Thank you very much for joining us.